Hi, Chris Montera here at NACCHO 2013, the conference in Dallas, Texas, and we're going to talk about telling the story of public health and why that's important up next. Hi, Chris Montera back at NACCHO 2013 here in Dallas, Texas. I think we're in Dallas, Texas anyway. Yes, we are. I'm here with Dr. Umair Shah. Thank you very much for coming.
Thanks for having me.
Well, awesome. So tell us, first off, what do you do? Where are you from?
So I'm originally from Cincinnati, and I somehow found my way through the public health world, the healthcare world, and got down to Texas back in '96, '97, and I've been at Harris County Public Health since 2004.
Wow. So what kind of practice did you have as far as a physician before?
I was actually internal medicine trained, and I did a primary care general medicine fellowship where I did a lot of HIV clinical work. But then I became an emergency department physician at the Michael E. DeBakey VA Medical Center in Houston. So I was an ER doc for several years.
Which is primary care, really, for the most part, right?
It's a very different field than public health, very different.
Right.
And from there I moved into, I actually got a master's in public health, and I decided, gee, I should actually do something with this. And lo and behold, I left, not fully left, I think I should say I transitioned, because I still do clinical care, but I transitioned into more population health.
Right. So what's interesting to me is we've had many physicians on the show this week. What do you find intriguing about, you know, the individual healthcare versus population health? What drew you to it?
So when I was actually in my training, I did an internship in international health policy at the World Health Organization in Geneva, Switzerland.
Oh, nice.
And that, I think, really expanded my mind, where I thought of not just individual health, but how do those pieces fit into the overall system's health and the population's health. So you asked an interesting question, because you said individual health versus population health, so I don't see it in either or, I see it as an and. And so it's really individual health and population health, and so one without the other would be
nothing.
Inefficient, not useful, and certainly would be dangerous. And so you really have to make sure that you strengthen both your approach to individuals and their health, but also to what's happening as your community, as your patient.
Interesting. So we were talking earlier. Tell me, so why do you think we have a problem in public health? You know, we have a great history of becoming who we were over time, but it seems like anymore even since the mid 2000s, where we've lost so many jobs in public health, why do we have such a hard time telling our story?
You know, I think that's probably the biggest thing, is really telling our story, and for folks to understand better both the connecting of the dots and also the fact that oftentimes what we do is invisible. And so it's very challenging to say, well, what's the value? What's the value add? What's the ROI? What's the return on investment on these kinds of activities that a health department or public health as a field are engaged in? And so here's an example that I oftentimes use is the concept of, we're oftentimes like a football team, where the offensive lineman, where the whole game you may be, blocking and all these other kinds of things, while the quarterback and the wide receiver are, getting all the headlines. But when you actually either don't do your job, or despite doing your job, something happens, just like the offensive lineman gets called for holding, and all of a sudden everybody says, oh geez, look, he lost the game for us. This is really a challenge where people say, gee, where was public health? And so when we do our job well, it's oftentimes invisible. And so when you have a poster child for cancer treatment, if I were treating cancer in a child and I was able to treat cancer, I could say, this is the child I treated. But it's hard to have poster children for preventing cancer in the first place, or preventing obesity in the first. It's hard to say that, because it's more of a nuanced messaging that oftentimes becomes difficult. And so I think that connection of dots is where we have not done a good enough job of telling our story, and also we haven't done a good enough job of being able to really take on opportunities where we can tell the story and say, gee, this is an opportunity for me not just to talk about the restaurants and here's what's happening with our restaurant inspections, but really to talk about, you know, something that's going to really connect with, you know, the public. Here's the same thing with tuberculosis or obesity. How do we figure out a way to really tell that story? I don't like to say sell the story, because that sounds to me a little bit under the table.
It cheapens it a little bit.
It does. Right. It's really about telling the story in a way that really is true to why what we do matters and why what we do is actually valuable to the community and the community's health. And so when you say to people, do you want your community to be healthy? You would find very few people that are going to say no. So it's really now about how do you connect the dots and try to engage people so they understand better what you bring to the table.
Okay, so well,
a lot to.
Well, it is a little bit to kind of grasp, and you know, how often do people in public health go? Well, your family goes, well, what do you do all day? I look at data, I crunch number. You know what I mean? They don't quite understand maybe that human impact piece, and I think they have to be engaging in some respect. And I think, you know, as I look at advertising and things like that have been successful in anti-tobacco ads or things like that, where you have the poster child of the person that smoked all their life and now they can tell their story. It's much harder to do that with cancer, like you said. So looking forward, then, how do we then recruit young people into this field where it's hard to tell the story? Where do you go with that?
Mm-hmm. So first of all, I think it's a complicated, if we had figured this out, I think we would have already done it.
Right.
So it is challenging. But there are a number of ways of doing things in a way that really is going to allow us to push the messaging further, allow us to really build some of those bridges. So first of all, we have to understand ourselves, what is it that we bring to the table? What is it about what we do that's valuable? So we have to understand ourselves what that is. We have to really get better at understanding what is the cost effectiveness of a programming that we do. We have to understand, oftentimes in areas where we don't feel comfortable talking, ROI, value add, cost effectiveness. These are some terms that oftentimes are in language that we're not as comfortable because it's not the doctor language, it's not the public health language, it's not the public nursing language, it's not the sanitarian language. Yet many of the decision makers, oftentimes that kind of language, connecting that language really resonates with them. So they actually understand ROI and value add and value investments and what am I getting the bang for my buck and things like that. People understand that, yet that's traditionally not what we have felt as comfortable with using as language. We've lost an opportunity of connecting as well with other folks who that's really going to make a difference. But it is about really understanding better what we do and what we bring to the table. And the challenge I think we have as a field is that we do so much. You know, it's not like we are just X type of agency that just does an X activity. We do X, Y, and Z, plus go A all the way through Z. We do all that. And so, and if you see one health department and you compare it to another health department, they will be markedly different. And so you see one, it's just N of one. You haven't seen all of the 3,000 plus health departments out there. So I think the challenge is really, so some health departments doing primary care. Some health departments say, our department doesn't do primary care. Some health departments really robust on immunizations. Other health departments, we actually work with community partners that do immunizations. So, it's a challenge of the field, yet we have to understand that there are, like you talked about it a little bit earlier about marketing and really, the folks that are public relations who have a better understanding of what it is that we're trying to get out as a message, and to be able to then stick to the message and have an opportunity really to get that message out, sharing it with partners who know the work you do. So if you have partners who love what you do, why is that testimony not on your website?
Right.
Why do we not have the as we call it, and we're in Texas, so I guess you can say the attaboys, attaboy, you did a great job. Well, why is that kind of positive feedback not given, so that if you're now called somewhere and the question on the table is, we're going to potentially cut your programming, or the sources of funding is going to go down, we now have advocates for us, partners and stakeholders who say, don't do that.
Right.
Don't do that. So it's this real connecting of both relationships, but connecting dots so people understand that if we do something here, it's going to really have an impact here. So let's not decrease resources with this public health aspect, because it's really going to have a downstream impact that's really going to be very important to our community's health, which again, oftentimes people don't want your community's health to suffer. They just don't understand that there is a relational concept there.
It's funny you mentioned that. Oh, right over here was one of the poster presentations, read it the other day, about school nurses in a school in, I think it was in Kansas, and how during the kind of the economic downturn, they started letting some of the nurses go, and as they did, they had a higher rate of missed classes from the students, and so they directly correlated that to the healthiness of the school, and they brought all that back. And to me, that's fascinating to see that you can have a direct impact in that, and until people see that, it's almost like, oh, we really messed up. So I always like to so there's two questions I have coming up. So one is, are there people, public health economists, is there such a field? Is anybody doing work like that to say that where we could really start showing that value? So we could talk to politicians who are really generally people that are business people at heart. How do we get them to understand that ROI? Are there people out there helping us make those connections? Have public health and economics.
Absolutely. So I think that there are definitely these intersecting fields that are working together. But the challenge is, we have not done. Again, it's not that we haven't done any of it. Right. That would be incorrect. It's that we haven't done enough of it.
Okay.
And so it's that you have maybe these economists or health economics field, or the public health economics, and you have these folks doing things, but it's in a language that we in public health feel comfortable, because it's our language, we understand it. Sometimes we don't even understand it fully, but oftentimes we understand it enough that we say, yeah, we're good with that. Our challenge is to take that and translate it into a body of work, and even some public relations, some marketing strategies of really explaining, again, not because you're cheapening something and you're selling something, but because you're really trying to advocate for the value and the importance, because we truly all, as public health professionals, believe that what we do is valuable. So this is really an opportunity to really do that, to transition to a point where you say, there is value here, and we're going to tell this story, and we're going to relate it to the folks that are in the audience so that they better understand. We want to engage. So it's the engagement piece that's really a big issue. And I do want to have another, but I want to, you had a second question.
Well,
I just want to make sure
what I'm hearing is turn passion into dollars, really, is what it comes down to. And I always like to take what we're talking about, because this is a very high level kind of stuff. It's, touchy-feely because that's who we are, but I'm a local public health agency, I'm small. How do I do that? Well, I mean, give me, what are ways that I don't have a market, I don't have people that can deal with this. You have small public health agency that maybe has 10, 12, 15 people, and they're barely getting by. Where's the resources for them to do that? I mean, NACCHO is obviously a great place, but where else could they go to get some of that bang for the buck, where they can bring that together and then show their decision makers in their community how that's done?
Well, I think that I don't want to gloss over what you said about NACCHO, because there is an absolute critical role that NACCHO, the American Public Health Association, ASTO, Association of State and Territorial Health Officials, that they actually have as far as how do you bring this all together. Because if we do a onesie, twosie type of thing, and a one-off, you're going to be able to do some things, and I think it's valuable to do this for your individual communities, to be able to say this is something that is an issue that's in our community, and we want to make sure we address it. But we also have to come together, and that's what a NACCHO and other organizations does, is really brings people or agencies and organizations together so that we're actually telling a common story, and we're leveraging and getting synergy and really working towards bringing those resources in a common platform towards a common goal. And now you can say, okay, here is the campaign, or here is the messaging, or here is the kind of platform that we've developed. And now you let some of these local health departments be able to adopt that in the way that's going to actually work for their communities. But I think it's also important that when local health departments really look at what else is going on in their communities, they look for opportunities that come up. So if there is an infectious disease that occurred, and you weren't quite ready with your public messaging, and you got through it, but it was a little bit clumsy. You got through it, right? Learn that lesson. File it away. Be ready, because unfortunately, that kind of a situation is going to happen again. It might happen 3 months later, it might happen a year later, it might happen 2 years later. It might be a situation that will be nuanced and different, but enough that you can take what you wanted to get out there from a public messaging standpoint and be able to apply it for the next opportunity that comes up, and say, we really want people to know that it's really important that we spray for mosquitoes for West Nile virus. Well, that West Nile virus season will come every year. So what you want to do is be ready, so that the fall, if you weren't quite ready the first year, but you know next year will come again. And so now that's the opportunity to partner with the media, make sure you get the messaging out to your other stakeholders, your other partners, and really to folks who might otherwise not really, again, know what's the value and that what's the role that you're really playing there. It's a critical piece, and I think it's undervalued. So we sometimes think that it's a lot of money, but sometimes we have to look at the low-hanging fruit. You know, it's not about, you know, now in the age of, you know, the web and social media, and, you know, whether we're looking at Facebook and, you know, YouTube and all these other kinds of the Twitter and all the things that you guys are doing, podcasts. These are things that health departments, for really a limited budget, can actually invest in and be able to reach the community, and especially the younger folks in our community, in a way that we otherwise traditionally have not been able to reach before.
Wow. Well, and that's great advice. I think that really kind of, obviously that speaks to me a little bit, but I think that it really should bring home some of the message for people, again, in the trenches every day, to say, yes, it's very easy to do, it doesn't cost a lot, but the value at the end it could reap huge benefits. So Doc,
I did want to say one other thing, is that there has been a little bit of potential confusion that's out there with what's happening around health insurance and the Affordable Care Act, that a lot of folks have started to think, well, if we give our population the ability to pay for their health, access to care, that is going to make them healthier. And I would really turn it on a dime and say that health insurance is a necessary step, but it is not a sufficient step.
Agreed.
So again, it goes back to individual and community, or you asked the question, individual and population, It goes right back to that. Because at the end of the day, what we're really saying is that you can't just have health care or health insurance and a way to pay for something, because it's all these other social determinants, all these other health equity issues. And what am I talking about? Transportation. I'm talking about economics. I'm talking about making sure that people, you know, have good parks and places where they can exercise and do, and they understand, and they're able to move forward with really knowing why it's important to make the healthy choice the default choice and not the unhealthy choice the default choice.
Right.
That's hand in hand with health care. It's really population health. And it's really bringing that together that's critical. So I think right now is an amazing time. We have amazing opportunities, innovation, technology, this opportunity to really look at, you know, there's really such a light that's being, being shined on health care, and we have to really be a part of that conversation. So again, at the end of the day, people know that there is value, so that if there are discussions, that public health is also a part of those discussions, because people know inherently that we're valuable.
That's great. Doc, thank you so much. How can
that
people
helps.
get a hold of you? Email, website? Is there some way people can get a hold of you?
Sure. You can always go to our website, www.hcphes.org.
It'll be right. It'll be underneath.
It'll be right.
Yeah,
Right.
it'll be here.
Harris County Public Health and Environmental Services.org.
Great.
So absolutely.
Thank you, Doc. Thanks for joining us.
Thank you for having me.
And I'm Chris Montera here at NACCHO 2013 here in Dallas, Texas. We have more coverage right here on the NACCHO website. Keep joining us for that coverage all week long.